Clearly, the ability of this virus to cause significant illness in children is very, 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 very limited. We know of the post-immune inflammatory disease that you've heard about, but it's very rare. But in general, this virus does not cause significant illness in children. Secondly, and I think it's important, unlike influenza, where one of our biggest concerns is we've been able to show that it's really schools and children that become the instrument of transmission throughout our community. With influenza, we really don't have evidence that children are driving the transmission cycle of this. The most important thing as we reopen schools, and as I mentioned before, we're prepared to work with every school and every school district to help them find the right mixture of strategies for them to do this safely. Our recommendations are not requirements, and they're not meant to be prescriptive. We have lots of different options on how the schools can put it together. But what we do want to reiterate as we reopen schools is to remember the importance of protecting the vulnerable. That we will be strong on. It's important to limit the ability of individuals with significant comorbidities, individuals that happen to be elderly with comorbidities. We want to limit those individuals, their interactions in general in society, independent of the schools.
And remember early on, we said test if you have symptoms. And now we know that if you're under 18, the majority of you don't have symptoms. And so really figuring out, and there's universities working around the country on a saliva test. So it would be easier for children to put saliva in a tube, just basically what we call spitting in a tube, or spitting through a straw into a tube, and looking at that kind of innovation and testing. And what Admiral Giroir has been working on very hard is this antigen-based testing and getting that equipment into both vulnerable areas like nursing homes, assisted living, and other places, but also considering how a school district could use that would make it much easier to test and to use saliva. So all of those are being worked on, and it's why we've been pushing on the antigen test. I know you heard me talk about that in April. We're pushing on that because we think it is important for testing of students and testing in universities. But we have our data is skewed originally to people with symptoms and then skewed to adults over 18. And so we are looking very closely into that category by using our antibody tests.